Good afternoon, everyone. Welcome to Health Watch Northumberland's online talk. This month we're joined by Sam Mason, People, Project and Operations Manager from Pain Concern, who will talk to us about their charity and the support available in Northumberland. Please set your cameras off and microphone to mute if they haven't done so already automatically. We'll have a chance for questions and answers after the presentation is finished. So please use the chat function on Zoom for any comments or questions during the event. We will be sharing the slides after the event and a couple of other bits of resources as well. And the recording of this event will be put on our website next week. So before I hand you over to Sam, a little bit about ourselves, Health Watch Northumberland. For those of you unfamiliar with what we do, Health Watch Northumberland is your health and social care champion. We cover the whole county and hear from people about their experiences of health and social care services. All feedback, whether good, bad, happy or sad, is passed to those in charge of running services with the power to improve standards of care. We also help people get information and find out about support services in their local area and ensure the people of Northumberland have access to reliable information and advice about the health and social care, which is why we invited Sam along today. So without further ado, I'll hand you over to Sam, who will take us through our presentation. Sam, take it away.
Thanks very much. All right, let me just pop my slides on. And if you could just, Tim, if you could give me a wee thumbs up, let me know that you can see that all okay.
That's good.
Perfect. Lovely. All right. Well, thanks very much for inviting me along to speak to you all this afternoon. I hope everyone's managing okay in this heat wave that we've been getting. It's even made its way up to Scotland as well. But yeah, my name's Sam Mason. I am Pain Concerns People and Operations Manager, and I've been with the charity for the last 6 years. Throughout the presentation today, I'm just going to talk to you a little bit about who Pain Concern are and what we do, what services we offer. I will be given quite a lot of information throughout the presentation, but as Tim said, it's also been recorded, so you can play it back and you will get a copy of the slides and some accompanying information as well, and the website links as well afterwards. But yeah, just please pop any questions or comments in the chat as well, because we'll come back to that at the end. So I'm just going to give you a brief overview of the charity, a bit about the history of it, and then talk to you a bit about the work that we're also involved in. So let me move on to the next slide. There we go. So just a little bit about the history of the charity then. So we are quite a small charity. We are based in Edinburgh, although we do support across the whole of the UK. Pain Concern has been going since 1995. Our chief executive, Heather, she co-founded the charity. So she went on a pain management programme. And when that came to an end, there wasn't as many sort of support groups or Facebook groups where people could stay connected. So she set up a series of support groups which ran for a number of years. And then that just slowly developed into a helpline. And then, 30 odd years later, here we are. We've got our helpline, but we have lots of other resources as well to help. Like I said, we're a small team. We've got about 4 key members of the team, and then we have about 40 volunteers all dotted about the UK. And without our volunteers, we couldn't do what we do. They all do a sort of variety of different roles for us. So yeah, we're super grateful to them. My role is to manage our projects and our day-to-day operational activities. I don't have a clinical background, but those who are involved in training our team and our trustees as well, all they do have a clinical background. And having that lived experience involvement throughout the entire charity as well is very important to us. So right the way through from our volunteers to our trustee board and our advisors, um, they're all people that have either their own lived experience of chronic pain or a specialist interest in it. Everything that we do at Pain Concern is all about helping people live a better quality of life whilst living with chronic pain. It's not just for people solely living with chronic pain, it is also for healthcare professionals and people that might support people living with chronic pain as well. Everything that we produce at the charity and all the resources that I'm going to be taking you through just very shortly are all evidence-based. So everything that we publish is all written by healthcare professionals and pain experts, just so that you know that the information you are accessing is the most accurate, up-to-date and trusted information. So a little bit about why we do what we do. So in Scotland, approximately 1 in 5 of the Scottish population will experience chronic pain. And in the UK, it's 1 in 4 are likely to experience chronic pain at any given time. We know that chronic pain isn't easy to explain. We know it doesn't always respond to medication. And we know that living with chronic pain can significantly impact a person's life and the activities that they might be able to do, the roles that they play within family and relationships, and just, yeah, overall sort of day-to-day, it affects the day-to-day life. So our aim is to bring people together. We want to give people a voice. We want people to feel like they're not on their own living with chronic pain. And we also want to help people understand their pain better and ways to manage it. And I'm going to go on now and talk to you a little bit about how we do that and what services and resources we offer. So we do have multiple different resources and services that are available at any time for people to engage at the different stages that they're at, the different levels of readiness, and they're across multiple different platforms. So hopefully there is something for everybody. We also have in addition to the resources and things there, we also have specific resources to supporting families and young people with children, although most of our work that we do is aimed at supporting adults. In addition to the core services that we provide, we also work to raise awareness of chronic pain across the UK. We campaign to improve the provisions of pain management services as well. We're involved in many different groups across the UK. We have input into National Chronic Pain Framework, sign guidelines, and some of our resources as well have also been adapted by the NICE guidelines as well. With all the resources that I am going to talk about today, they're all self-referral, so at any point you can just reach out and use any of the services that you might find beneficial. So I'm going to start by talking to you a little bit about our helpline and online community. So our helpline is operated by people with their own lived experience of chronic pain, and they are fully trained to be able to offer support and guidance to anyone that contacts us. It is a safe space for people to get in touch. They might be looking for some specific information about how to manage pain. And the team are there, they're happy to listen because they've got their own lived experience as well. They are really the best people to relate to those that contact us. And of course, anyone that contacts us as well, it's a space where you can speak freely, and be free from judgment as well. Sometimes people contact us because they're maybe looking for specific information, which we will email them or we will send free of charge by post. Some people have contacted us if they've maybe attended one of our sessions and they've got some follow-up questions, so the team will help answer those. And sometimes people contact us because they're maybe looking for some guidance on how to apply different strategies that help manage sort of day to day. But one important point to note about our helpline is we don't offer any medical advice. So we're not here in place of the NHS, but we are happy to, listen and we give time, and a lot of people tell us that's what they're looking for the most. Our online community is an online space where people can come together, support each other, ask questions. We post a lot of information on there as well. And it's a place where, you can come to, share your voice as well, and your thoughts. Our team moderate it to make sure it's a safe space for people, because we want people to come on here and be able to talk freely without fear of judgment or harassment. It is quite a lively forum. We've got quite a number of members. So they'll often, put posts on about maybe sharing about how they're feeling that particular day, and the other members will respond, give a wee bit of encouragement, a wee bit of support as well. So it's a nice kind of friendly atmosphere. We also have our content labelled as well. So if you're looking for specific information, you can go directly to that folder and access the information quite quickly as well. And the good thing about the forum is that it's there 24/7, so it's always accessible. We also do podcasts, and our podcasts are called Aid and Pain. And we've got over 153 episodes of Aid and Pain currently. So if you like a podcast, you're in luck. There's plenty on there, and they all cover various different topics as well. So the latest one that we've just produced is on the subject of nature and mindfulness. So that kind of covers all about applying mindfulness practice if you're outside, but also how to apply mindfulness if you're not able to get outside and you look at nature through like a window. So yeah, they're all covered various different topics, and the good thing about them as well is that you hear from the specialist or the expert talking a little bit more about the subject, but then you also hear from people with their own lived experience as well, talking about their situation and what they do, what helps them to manage as well. So they're all available on our website as well, but they're also available on any other platform that you might get podcasts from. And we also have the transcripts available for each podcast as well. So one of our most popular resources that we have available is our Self-Management Navigator tool. Now, the whole purpose of this tool is to help people who are going to their GP or their healthcare appointment, and you know what it's like. You'll have in your head what you want to ask and what you want to talk about, but when you get into that appointment, anxiety can kick in, brain fog, and you come away and you think, I didn't ask that, I should have said this. So this tool just helps people prepare in advance for their appointments. It's got kind of key areas in it that you might want to focus on during that discussion. You know as well, some GP appointments you only get between 7 to 10 minutes long, so it is quite a short time. So this again helps you just stay focused on what's really important to you during that consultation time. As I said, within it, it's got different sections. So it doesn't need to be filled out completely. It's just whatever is important to you at that particular time. And you can just fill it out and hand it to your healthcare professional. And when this tool was created, it was created with GPs as well. So it is designed to trigger action depending on what's ticked within the tool. But I have got a little short video clip which just explains a little bit more about the tool and the benefits to both individuals and healthcare professionals as well when patients use it. So I'm going to pop that on just now, and hopefully you can all hear that okay.
It's a revelation to use something like this in the consultation.
It changed the way they think about their pain. It was an educational tool. It very commonly brought out problems in their lives or their history or their experience of chronic pain in the past that they hadn't really ever considered might be relevant.
It focused me on actually what I was coming to the appointment for. I was homing in more on what was bothering me about that. Was it that I was unsure about the diagnosis? Was I worried that I was on the wrong medication?
What the toolkit and using that helped me to do was to look much more effectively at the patient's life, how it was affecting them and how I could specifically support them to make changes.
And the tool's available on our website as well. You can download it, or if people prefer printed copies, we'll send it out to you free of charge as well. We also do a quarterly magazine called Pain Matters. So again, this is available on digital and printed copy as well. But each quarter it's guest edited by different authors so that it brings a wide range of perspectives from across the UK. It contains different news and different features on practical tools to help manage day to day. And it's not only just for people that are living with pain as well, but it's also for people that support those living with chronic pain to learn a bit more as well. This is our only resource that we do charge for. For the digital subscriptions, it's £6 a year. And if you do want a printed subscription, it's £20. And like I say, it's the only resource that we have that we do charge for just because of the cost of the production of it all. But we don't want anyone to not be able to access it. So if paying for it isn't an option, we do concessionary subscriptions as well. So just please get in touch with us if that would be helpful for you. In addition to in addition to the quarterly magazine that comes out, we also do a digital newsletter as well. And that just helps keep up to date with what we're doing at Pain Concern, what we're involved in, any new resources that are coming out. Also gives you like the heads up if there's any spaces available on any of our courses and things that we might have. On the screen there, you can see he's called Ian, also known as Mr. Cookfulness. And he has designed a recipe book specifically for people with disabilities or long-term conditions who might want to cook but find it difficult or find it painful to do so. So he's adapted a series of recipes, and he includes different equipment as well that you can use. So we always feature one of his recipes every quarter as well. And it's another way of being able to support the charity as well. So moving on now, I'm going to talk to you a little bit about our pain education sessions that we have been running for the past 2 years now. The whole purpose of these sessions are for anyone who's had pain for 12 weeks or more. Again, we open it to family, friends, employers, healthcare professionals to come along and learn a little bit more as well. But it's a one-off session that is designed to help people understand what chronic pain is, why it does what it does in the body, and ways to manage it more effectively in the long term. So we cover topics such as pain science, managing activity and flare-ups, managing stress, and getting a good night's sleep as well. It's delivered by two of our pain educators who are people with their own lived experience as well. So everything that we talk about during these sessions are all very relatable. And our trainers have been fully trained. They were trained by the lead clinician at one of the NHS pain services in Scotland, and they've gone through quite a robust training programme as well to make sure that the sessions are delivered safely. What I'm going to do now is just show you another short little video clip. And this video clip just explains a little bit more about the sessions and what you can expect as well. And at the very end of the video clip, it does have the booking details, but don't worry about capturing any of that because the slides that come out will also be accompanied by a flyer which has all the booking information on there as well. So I'm just going to pop that on. It's a couple of minutes long, but it'll just give a little bit more information.
Do you have long-term pain? Do you understand what's happening? You can learn more about persistent or chronic pain and what you can do for yourself to help manage it at a free 2-hour online or in-person education session.
I'm David Craig. I'm a clinical psychologist and I've worked for the last 25 years in pain management in Glasgow. And these classes are designed to empower patients with chronic pain to understand more about the pain and how to manage it.
I had somebody who was a pain trainer come and tell me her story, and it just blew me away. I thought, wow, if I could get a little bit of her success to do something I liked, then I'll be happy. I can die happy.
Somebody who takes part in the sessions will expect just to get some hints and tips and also some experience from people with lived experience on the nature of chronic pain, but also how it affects activity, how it affects mood, how it affects sleep, and what they can actually do about those individual areas to help themselves.
I don't know if you've heard about the 15-minute rule. So if you haven't fallen asleep in the first 15 minutes, get up for 15 minutes. What I don't do is put on an iPad or a phone because the blue light will make you even more awake.
The power of these classes come through the delivery of the information by people with lived experience. That takes the information to a whole other level, and a level that health professionals who don't experience chronic pain really can't take that information to.
See, when we deliver the sessions to people, it's not pain educators and participants, it's one big community. We're all living with chronic pain, we get it. We're seeing it in our feedback all the time. I did a session yesterday and somebody said, yes, the presentation's wonderful, but the most important thing for me was the fact that I was with people that could relate.
I now live a full, active life, and I'm the mum to an almost 5-year-old little boy. And again, that was something that I never thought I'd be able to do, is to have children. I never thought I'd be pain-free or medication-free enough to actually have a child.
For more information about pain education sessions, you can call 0300 222 5774. Text 07480 632 774. Email pain-education@painconcern.org.uk. go to Pain Concern's website at painconcern.org.uk. Scan the QR code on the screen or ask your health or care professional for more information.
So hopefully that helped just give a little bit more insight into the sessions and what to expect. The sessions are open to anybody, regardless of where you're based in the UK. We are doing online sessions currently. And they're very informal sessions, they're very relaxed, very much like this. You know, you don't have to have your camera on, you don't have to share anything. It's only, you only do what you're comfortable doing. So yeah, if you are interested in any of joining one of those sessions, you'd be very, very welcome, and the details on how to book will all be sent out after today. In addition to what I was just saying there about the sessions, is that I think probably one of the biggest benefits that people have received as a result of attending has been the fact that they were with people who can relate, who are going through something very similar, and just feeling like they're not on their own is one of the biggest sort of takeaways from these sessions as well. And I think having their pain validated as well, and the educators sharing their own experiences were really, really valuable to everybody. I am almost coming towards the end of the presentation, but just a few things to point out before I go. We also run free mindfulness sessions as well, so they're also online. They're delivered by Kath, who is our mindfulness coach, and also a person with lived experience of chronic pain. And so she really tailors the sessions to people that are living with long-term conditions. Again, they're very, very popular. We run a variety of different sessions throughout the year. So we do tasters, we do 4-week courses and 8-week courses as well. So yeah, they're all free of charge and they're online. We're actually starting a new 8-week course on the 21st of July, so a couple of weeks' time. So if you are interested, I think there are still a few spaces available. So yeah, if you are interested, get in touch with us and we can get you booked in. And that is it from me, just a short presentation, a quick overview of everything that we do at Pain Concern. I hope it's been helpful to just hear a little bit more about who we are, for anyone who wasn't aware, and all the resources that we've got available as well. And you know, you're welcome to check out anything at any point. Always get in touch with us via phone, email, text. If you've got any questions, if you're looking for anything at all, you're very welcome to always get in touch, and we'll come straight back to you. We're also on all the main social media channels as well, so you can follow us on there. We do post a lot of information, and we'll share a lot of resources and things on there as well.